everyone, we're Team BP Rising, Team 7118, and we're here to talk about our iOS application, BP for Everyone. I'm Rohan Iyengar.
I'm Joshua Sanji.
I'm Chris Blackstone. And I'm Jacob Light.
So just to give you a quick overview of our application first, our iOS application is a tool that lets you put in BP pressure readings and get detailed information depending on who you are. And we use this app to support both medical professionals, which are doctors that want detailed medical information, and everyday users who just want to log their blood pressure data. So I'm going to go over the agenda about what we're going to be talking about today. First, we're going to be going over the motivations. So who would want to use this app? What are the underlying causes behind the issues that this app is looking to solve? Then we're going to go through the users. We have 2 users, caregivers and medical professionals, and I'm going to detail what each of these types of users are. Next, we're going to go to talk about the previous work and the highlights of what we've done this semester. Second to last, we're going to show you a live demo of our app and go over some of the most common features. And lastly, we'll be talking about future improvements and what we want to accomplish next semester. So I'll start off with the motivation. Our client's name is Don Batisky. He's a pediatric nephrologist. In layman's terms, he's very experienced with hypertension and blood pressure. So some of the problems he and other medical professionals have seen are that medical professionals that aren't experienced with blood pressure data may make very careful referrals to a hypertension specialist when a patient really doesn't need this referral. And this puts a big temporal and financial burden on the Medicare system that's already very crowded. This is especially true in the case of adolescents. Adolescents are going through puberty, have a lot of hormones going through them, and are going through a time of change. There's a much higher variance on what's acceptable in terms of blood pressure ranges for adolescents versus adults. Lastly, the current applications that try to tackle this problem are not user-friendly. A doctor couldn't just take out their phone in the middle of an appointment with a patient, enter their information, and get detailed results that they could show their patient in 1 to 2 minutes. We seek to alleviate this problem, and our #1 goal is ease of use. So I'm going to go over our 2 users. First, we have the medical professionals. These are doctors, nurses, and anyone else who's put themselves through school and is now part of the medical system. We split this category into 2 types of users. One is expert medical professionals, which are people like our client that are very familiar with blood pressure data and would need very specific types of information to touch up on using this application. And the second type is other medical professionals. So they would not be expected to know as much about hypertension and blood pressure, and we'd give them more detailed information when they use the application. Finally, we have the caregivers, which is everyone else. These users are not bound by the HIPAA and healthcare regulations that doctor-patient is, so they can keep a record and store their blood pressure recording history. And they can easily pull this up and show it to their doctor in an appointment. I'm going to hand it off to Josh, who's going to talk about our highlights of our current work that happened this semester.
So initially, we created a prototype application that allowed the user to choose whether or not they were a professional or a caregiver, and it would walk them through the process of taking a blood pressure measurement, understanding it, and recording multiple blood pressure measurements if they're caregivers. We found a few issues when evaluating this prototype with real users. Some of the wording used for the caregiver side of the app was confusing to home users. They didn't understand systolic versus diastolic blood pressure, for example. The solution to this would be to add better explanations and more home-friendly names on the home user side of the app, and add quick links wherever we have a field that could be hard to understand for the home users, so they can instantly get some information on what the measurement means and what to enter into it. On the professional side of things, they found the wording of caregiver very confusing. They expected more of the wording of patient, along with a few other difficulties with wording. So what we've learned is that we really do need a better separation between the home user and the professional user when it comes to the overall workflow of the application and what each user sees. Finally, we found the actual choice of whether or not you're a caregiver or professional was itself confusing users. They couldn't easily go back and choose a different one, and they just found the whole choice unnecessary in the first place. So we decided to split the app into a separate professional and caregiver app. That way, it's very concrete, the differences between the workflows and the applications, and as well, an actual user doesn't have to care about whether he's a caregiver or professional. They'll just download the correct app. Hopefully, they'll hear the app from somebody who tells them the correct version to download, and the whole issue is avoided in the first place. I'm going to hand it off to Chris, who's going to demo what we currently have.
To begin with, we'll look at the BP for Professionals app. So you can quickly see that it's very streamlined and easy to quickly analyze a blood pressure. Just click there and then you can select between the male and female, the age, their height, weight, and finally enter their blood pressure. And then select Analyze. Upon selecting Analyze, you will receive a screen giving the blood pressure percentiles, as well as different charts and graphs and interpretations relevant to a medical professional. Medical professionals can also access some of these links directly under Quick Resources. For example, here we see listed the 4th report on the diagnosis, evaluation, and treatment of high blood pressure in children and adolescents. Now we explore the Blood Pressure for Everyone app. Here the idea is everyday users will want to learn how to take accurate blood pressure measurements and track their blood pressure over time so they can easily share that information with doctors. So you can track your blood pressure, you can add yourself as a patient or add any other family members or patients, and you can see their last blood pressure here, and underneath Go Into them you will be able to see their history of blood pressure as well as record a new blood pressure similar to that of the Quick BP analysis for professionals. They will also receive some quick resources, but theirs will be more simple articles such as how to measure blood pressure accurately or how to maintain a healthy blood pressure. And those are both of our apps so far.
I'm going to hand it off to Jacob Light for the future implementations for our application.
Right now, the current prototype gives an idea of the layout for the app. However, features that would be things that are shown as a result of user input are not yet implemented, so we will implement those next semester. Beyond feature set, though, it will make the interface easier to understand and navigate. This means, as Josh mentioned earlier, simpler terminology. This means taking systolic and diastolic blood pressure, those would be the top and bottom numbers of the blood pressure reading, and making their definitions more clear to the user. It also means having 2 different applications, one for medical professionals, one for caregivers. The big reason behind this is that the use cases are so different between both kinds of users, and it would mostly be redundant for a medical professional to ever use the caregiver side of the app, or vice versa. We also want to minimize the time taken to complete more lengthy tasks. Now, these earlier changes will help in doing that, but we also want consistency throughout the app to help minimize this time. This means having a back button on each page so users can correct their mistakes, and having that back button on the same part of each page so users won't have to look for them. These changes align with our top priority for next semester, which is ease of use. We want to combine performance, simplicity, and consistency to provide as much of a pleasant user experience as possible. Thanks for listening.